Appreciating the beauty that is Kenya with those pictures. It is your world. My name is Gladys Gashanja. A lot of your feedback coming through even as you answer that question of the day. Or are you or somebody you know living with disability, and how are you coping during this COVID-19 season? Let's take a look at some of them. Anthony Nganga says persons living with disabilities experience peculiar challenges in going about their normal lives. This COVID period makes things even worse. We must take deliberate actions to alleviate their living conditions and make this world more inclusive for everyone. Very well said, Anthony. Another here from Mugambi Paul, who says the National Construction Authority should have taken advantage of COVID-19 and produced accessibility guidelines for buildings, while the Transport Ministry should do the same. Very well said, and I think that has been alluded to by the speakers this morning. Do we have another one? Last one here from Lizzie Kiama, who says programs and services need to be modified to accommodate those living with disabilities. They need not be left out or left to well-wishers or to their masses. Very well said. And we keep taking your comments, keep them coming through. Now, as we talk about this, I'm still joined by Mildred Omino here in studio, Samson Waweru in our other studio here at the Nation Center, Samuel Odao joining us from the Mombasa office, and we have Lizzie Kiama, who is the Managing Trustee of Disability, joining us online. And by the way, those that are wondering, she is physically impaired, so she speaks from a point of authority. Thank you for staying with me. Now, as the country continues with the fight against the unseen virus, people with disability feel they have been neglected by their government. People with disability have not been factored in the money that was set to support vulnerable people in society. Ruth Samway spoke with one who is visually impaired and has prepared the following report.
For 32-year-old Angelina Kai, the COVID-19 pandemic has cut short her only source of livelihood as a consultant and a disability rights advocate. She would frequent workshops and conferences to champion the rights of persons living with disabilities, but such forums have since stopped.
Meaning that I'm not working, I don't get anything, so therefore my source of income has been hampered with completely. I've been using my little savings to just take care of myself, but now it is completely depleted, and I currently rely mostly on well-wishers like family and friends.
Angeline says they've also been left out of COVID-19 information shared on TV, newspapers, and even the social media.
On TV, they say, for example, if you see or think that you have the symptoms, you call this number. I think the number should be voiced. It uses a lot of infographics, diagrams sometimes that you require sight to be able to see. So there should be like text later that will be read, that you can be able to read. And are we getting this? We should also be getting the accessible formats. Like for me, I would love to know to get a braille information I can read.
It is also hard for them to adhere to some of the government's directives, such as social distancing.
We touch a lot. We use our white canes, and we have to have someone, a guide or someone who is going to assist you on the way. So right now with the social distancing thing, it's a big blow for us as visually impaired persons. Everyone is treated as a positive case, so no one can even help you do what you want, go where you want to go.
According to the 2019 census, there are approximately 1 million people living with disability in Kenya. Ruth Sarmoi, NTV.
Challenges for those living with disability during this COVID-19 season being amplified in that story by Judith. And it is interesting, even as we look into the menstrual hygiene month, Lizzie, that most people have not thought of how to alleviate that challenge for the girls and women living with disability. What should be the ideal situation?
Sorry, I have to ask if you can hear me.
Yes, I can.
Yeah, great. Okay. So it's sad that we are now, kind of fighting fires when our advocacy organizations of persons with disabilities have been saying include us from the very beginning, because it is this inclusion that helps us innovate better and prepare better as a society. So for me, I think what we've been trying to do is create opportunities where service providers can begin to interact with communities of women with disabilities to understand what their needs are, because most of the time they design products that they think cater to the majority, but these products are very repetitive, and there's no innovation that goes into it. The opportunity that women and girls with disabilities present in this situation is when you consult with us, then we are able to feed in to your processes, and we can create solutions together that can serve the larger majority. So it's very important, it's critical to engage with communities of persons with disabilities, women and girls with disabilities, men and boys with disabilities, in order to co-create processes and solutions together. So in this time, for me, as a society, we need to ensure that our most vulnerable, as a default, our most vulnerable in the community is taken care of, and then build and improve structures based on that, because we have now all been reduced, and we can all see our vulnerability, and how we are now dealing with similar issues. Communities of persons with disabilities have talked about living in isolation, inaccessible amenities, from education to healthcare. Right now, everyone is going through that. If we had sorted persons with disabilities, then we would have a very strong system that could withstand this. But now we're left to fighting fires, which is very unfortunate.
Okay, and Mildred, the 2019 population census clearly showed that a majority of those living with disability are actually in the rural areas, and those in the urban centers and the informal settlements. So how can counties ensure that they cater for the vulnerable?
Thank you, Gladys. That's the reality on the ground, that majority of people with disability live in rural areas, and those in urban areas are largely in the informal sectors. So it means that the responsibility of taking care of the needs of persons with disability does not only lie on central government. And also we need to shift from the mentality of leaving disability support services to donor agencies like it's been in the past. Because most of the time we've come into situations where people with disability need services, but then they're like, okay, there's an organization or a donor agency that does this and that. We need to take it as our responsibility as the national government and the county governments. That is how we'll end up reaching out to people with disability from where they are. Actually, disability inclusion should be at the point of service delivery. It cannot be left as a centralized issue. It has to be dealt with at the point of service delivery, meaning that all county governments should include the disability in their strategies. Like we need to see the county development strategy plans which have disability component in them. Like right now, we just found ourselves going through online learning because of COVID-19.
Yes.
It's unfortunate that this is the time that we are thinking about people with disability, and we are like, okay, how are exams supposed to be administered to these people? How are they supposed to attend the online classes where we don't have the right softwares to enable blind people to access information? And like every other panelist have said, we seem to be fighting the fire. At the end of the day, we are going to subject our learners to examination. But then how are we going to address the equity that has been brought about by online learning challenges? How are we going to address the inequities that you are experiencing in healthcare? How are we going to address the inequities that you are experiencing in terms of reproductive health services or menstrual health, hygiene management? So the best way to deal with it is, like, we've devolved our government. let us also devolve it in totality in terms of service delivery to all, and all means every other person, including people with disability.
Okay, now Samuel, somebody is asking here, taking you back to the issue of physical and mental abuse for those living with disability. Is there a special helpline that somebody can call in case of anything?
Thank you, Gladys. Allow me to combine that question also with the issue of women and girls with disabilities. The point I wanted to make is to emphasize on partnerships and collaboration, because disability inclusion is, the quest for disability inclusion has to be multifaceted, so much so that we must synergize our efforts. We are working with DPOs, disabled persons organizations, not only to pass information to them on what government is doing, but also to receive information from them on the situation on the ground, as it were. What are persons with disabilities going through? What kind of support services do they need? And then we pass them on or refer them, such people who need assistance, to available support services. Because unfortunately right now, we still do not have the special helpline for persons with disabilities. But we receive information of persons who require such help. And I should also add that talking of women with disabilities, we know that they are doubly marginalized. Because first they are women, and then second they are persons with disabilities, and you know, women are also part of those that are marginalized. So now it means therefore that not only should we work on partnerships and collaboration, so that I know what Millie is doing, Millie know what the council is doing, and we can partner both at the national level and at the county level. And even the county integrated development plans, there are counties that are doing quite well, like Uasin Gishu. And Kisumu, we are receiving reports from such counties. And we encourage disabled persons organizations and civil society organizations to work closely with those counties so that this information reaches them. And finally, teach our girls and women on self-advocacy. That is something that US is doing quite well in, and even in Europe. Let someone speak for themselves. Yeah? I have a problem, I should be able to speak for myself, and of course work with the DPOs so that we are in line with the requirements of both local and international law, and that we help people to live independently, as I think Lizzie, who alluded to autonomy, I think it's more of independent living and independently voicing your concerns. So it is important that this information is not only shared insofar as what we are doing as government, but also what is happening on the ground, so that those who require services get it as swiftly as possible.
Samson, even as you are the chair of the Kenya Society of the Blind, how can the trickling down of information to those living with disabilities made and to reach all and not leave anyone behind?
So I think what my greatest lesson during this pandemic is we have focused more on physical inclusion and institutional inclusion, but now it's a reality that digital inclusion has to be tackled right now, right away. Mildred has mentioned the fact that softwares for blind people to access information are not easily available. And this is very true, because for us, our phones rely on a program known as TalkBack that has to be set and everything, but at least that one is affordable, because once you buy a phone, you just install it and use it. But now with the computer, you need an assistive screen reading software known as Job Access with Speech that is 120,000. Yeah? So how many people with disabilities who are blind in informal sectors especially would be able to afford such software? And this is where we say now the government has to come in and ensure that digital inclusion among persons with disabilities is fully attained by subsidizing such of these costs, by providing incentives that will enable people who are blind and visually impaired be able to access these devices. We are talking about digital literacy, whereby the kids at home should watch Edu TV or listen to KBC. And I've sat down and listened to those programs. And I can tell you, teaching a kid with visual disability would take quite a different twist than this other kid. For instance, I'm sitting at the TV and a diagram is being shown maybe in biology, maybe the diagram of a tomato. How will I know this part is the one that has been given a certain labeling? Because these inequalities in education have lived with us. We have stayed with those challenges. I thank God some of us overcame those, but many more other people with disabilities went back to the villages and to the houses, because you find that you have a diagram of a tomato on a piece of paper. You are blind, you've never seen anything. How would you imagine a tomato being flat on a paper? It needs to be brought to you like in the actual tomato, so that you can be touched and say, this is this part, this is this part. Those are some of the things that I'm feeling haven't been looked into over a long time, and now it's difficult to deal with these other issues that are coming up. But I think we can catch up. We can catch up, and I'll really request CS Magoha to come to the table and call every stakeholders, mostly the Society for the Blind, so that we are able to contribute and give a 2 cents on these large inequalities in education. We have 40,000 school-going children, and yet a large number of that, like 13,000, have not gone to school. They have attained the school-going age, but they are at home because no one knows how to handle them. So unless there is synergized efforts from all the stakeholders, unless we collaborate, I think this is how we'll be able to tackle some of these challenges that we are facing.
Samson, very and very pertinent issues put across. Thank you for your contribution, and for all my guests that joined us this morning, even as we looked at COVID-19 and how that is disrupting the lives of those living with disabilities. I was joined by Mildred Omino, who is a gender disability advocate, Samson Wawero, who is the chair, Kenya Society of the Blind. We have Samuel Odao from Mombasa, Director, National Council of Persons with Disabilities. We had earlier Steve Kanywa, who is deaf, Lizzie Kiama, who is a managing trustee of the disability. We were joined by Isaiah Wafula, who joined us from one of the informal settlements here in Nairobi, who is blind. And so many points have been put across, and clearly glaring gaps in as far as those living with disabilities is concerned. Now, your feedback is still welcome, and speaking of which, Leah Kamere says it's time Kenya began training more dogs for the blind to give to the blind to help them cope during this and post COVID-19. Very good idea. Then another here from Ngoko Jemaima, who says the government should have put aside a special kitty for the people living with disabilities. Their day-to-day life is not as normal as people with disabilities. Actually, it would have been the first priority. Hope they will take action immediately. Our prayer is that following this conversation, they have seen where the gaps are. Eric Orlando, my son has become worse because we can't access the therapy sessions, and this is in relation for those that have neurological disabilities, and Mildred had alluded to the same. Do we have another question or comment? Simon Joroge, who says, Simon Joroge, PWD and a principal at Kamukunji Technical. Those living with disabilities have really been suffering, but the suffering is more pronounced during this COVID-19. The real cause is lack of empowerment of PWDs, especially with technical skills to make them self-reliant. Again, a very pertinent point put across there. And even as we look forward to tomorrow's show, let me say thank you for joining us on this conversation. Tomorrow we shall be talking about something that has become an ideal for many of us, which is working from home. Well, you can give us your suggestions and of course your experience during this COVID-19, what that means, the pros and cons, and what it means for work and careers going forward. Until then, my name is Gladys Gashanja. Take care.